The defense now finishes with Sergeant Lawler before the Commonwealth calls Lindsay's therapist, Letitia Dukes.
Sergeant Lawler, we're at the point where you are assisting, if you will, in the custody of Lindsay at Brigham and Women's Hospital when you observed a doctor enter into that area and ultimately into her room. Is that correct?
Yes.
All right. And the door was either closed or open or halfway, you don't recall, which is understandable, but you just don't remember if it was closed completely or open a little bit, right?
Correct.
But either way, you weren't eavesdropping or trying to hear anything, were you?
No.
And then when the doctor finished talking with Lindsay, at some point, you as investigators were aware that the doctor had allowed her to call her husband and use his cell phone to speak to her husband, correct?
I later learned that, yes.
And you later learned and knew from the investigation that it was fairly recently to that point that the tubes had been removed from her mouth and she was able to at least talk to a degree, and then she talked on the phone, correct?
Correct.
And after that, fair to say that you did not, when I say you, I mean collectively, all the police officers investigating for the DA's office, you did not see any reports or anything that would indicate what, if anything, was said between Dr. Zeisel and Lindsay in that room, right?
Correct.
And who is Sergeant, is it McElligan?
Sergeant McElligan, yes, sir.
And Sergeant McElligan, Joshua,
Yes.
he's the lead investigator in this case, is that correct?
Correct.
And at the time, he was a sergeant and you were a trooper, right?
At the time, we were both troopers.
Oh, both troopers. Okay, so you both got promoted. And he, as the lead investigator, told you in a conversation, or perhaps more than one, that the government theory is that Dr. Zeisel told Lindsay to say to her husband that she heard voices, right?
Yeah, if you can rephrase that.
Okay. Did you talk to McElligan about the theory that Dr. Zeisel is the reason that she told her husband that she heard voices?
Yes.
And do you remember where or when that conversation occurred, or how many times that you guys discussed that?
I believe it would have been at the office. I don't recall exactly when.
Okay. And there's no investigator basis for that. That's McElligan's speculation. Is that correct?
Correct.
That distinction matters. The trooper confirms he had no investigative basis himself for what was allegedly said during that private meeting.
When you went there and you observed Lindsay after the doctor left, she's still obviously in the bed because she's paralyzed, right?
Correct. She was still in the bed.
Was she restrained by either soft restraints or handcuffs or whatever? Do you remember whether her hands or her wrists restrained to the bedpost?
I don't recall specifically restraints.
Okay. And you mentioned that the state police were there. That would be people that were obviously working with you, right?
Correct.
And do you remember how many state police were there that you were coordinating or assisting?
Per shift, there was 2 of us.
2?
Yes, sir.
Okay. And also there were sheriffs from the Plymouth County Sheriff's Department that were there, right?
So we relieved the sheriffs.
Okay. And how many sheriffs did you relieve?
I don't recall exactly. Probably 2, though.
Okay. And how about Duxbury Police? You recall the Duxbury Police being there?
I do not recall Duxbury Police there.
How about the security cops for the hospital? Do you recall them being there, either in the room or outside the room?
I don't recall them being outside the room.
Do you recall coordinating with the security boss, the head guy for the hospital security?
I recall having some assistance at some point from security to get up there.
Okay. And do you remember how many days it was that you were assisting in the custody situation of Lindsay before she was allowed to have family and me and different people visit with her?
I don't recall exactly how many days.
About a week maybe, or less, or longer?
Less than a week?
Less than a week?
I think, yeah. I don't remember exactly, though.
And even though she was allowed to have visitors, still the police presence was there. Is that correct?
After I left. I'm not sure after I left what the visitation was like.
So when you say after you left, you mean when you left the hospital? You mean after you were finished with your tasked duty of dealing with her security and being under arrest?
Correct. After my assigned shift, I don't.
So after you were involved, obviously you don't know what happened after that.
Correct.
Okay. That's all I have. Thank you, sir.
Thanks, sir.
Redirect, Ms. Buckingham?
Sergeant Lawler, in your experience working in the detectives unit as a trooper, is it fair to say you oftentimes will have conversations as investigations are unfolding with other investigators that you're working on a case with about the case, potential evidence, theories of the case?
Yes.
And it's also fair to say that theories change over time based on your investigation and what evidence you find?
Correct.
Was there anything about a conversation that you had with Trooper McGilligan about this theory that affects your testimony as you stand here today?
No.
And you didn't hear anything that occurred in that room that day that you were there when Dr. Zeisel was there, did you?
I did not hear anything.
Nothing further.
Just briefly, well, your testimony, basically, unobjected to, is talking about clothes that were seized at the house and the other investigation going to the hospital. That's it, right?
Objection beyond the scope.
Sustained. All right. All right, anything further? All right, thank you, sir.
Thank you, Your Honor.
Thank you.
The Commonwealth would call Letitia Dukes as its next witness, please.
Good morning. Do you solemnly swear that the testimony and the jury shall be the truth, the whole truth, and nothing but the truth? You may have a seat.
Good morning. Good morning. All right. I'm going to ask you to keep your voice up and speak into that microphone, okay?
Sure.
All right, thank you. Yes, counsel.
Thank you. Could you please tell the jury your first and last name?
My name is Letitia Dukes.
And how do you spell your first name?
Latiesha.
How do you spell Dukes?
Dukes.
What do you do for work?
So I'm a licensed mental health counselor. I worked as a perinatal clinician at South Shore Hospital.
And what kind of education did you receive in order to do that?
So I have a bachelor's in psychology, a master's in mental health counseling, and a master's of education in mental health counseling.
And you mentioned the South Shore Perinatal Clinic. Do you still work there?
No, I do not currently still work there.
How long did you work there?
I worked there for about 5 years.
What did you do there?
At the perinatal clinic, I worked as a perinatal clinician, which involves like short-term therapy from prior to birth to postpartum, and supported with connection to care, whether that be therapy or higher levels of care, so intensive outpatient therapy, partial hospitalization, or inpatient care.
This is Letitia Dukes, the therapist who worked directly with Lindsay at South Shore's perinatal program. Her role included helping patients access higher levels of psychiatric care.
And do you often collaborate with patients and other clinicians at the clinic or nurses about treatment plans for patients?
Yes.
And do you help to manage the treatment plans with the patient?
Yes.
How do patients, or strike that, for your role at the clinic, doing the therapy and being the clinician, are you often referred patients by the nurse practitioners or somebody else who had seen the patient or did an intake with the patient?
Yes.
And do you work with that prescriber or practitioner over the course of the treatment with that patient?
Yes.
And as far as your role and what you do with patients, is it fair to say that a large amount of your ability to work with the patient is based on your relationship and rapport that you develop with the patient?
Yes.
And do you rely heavily on things that they report to you when you're assessing them diagnostically and trying to help them come up with a treatment plan and offering therapy?
Yes.
And one of the things that might be important in that is to assess a patient's presentation each and every time you meet with them, right?
Yes.
So do you do that in each appointment or each interaction with a patient, assess them for various things?
Yes.
And what kinds of assessments do you perform?
So I typically perform a psychosocial assessment, which is getting their behavioral health history, as well as their current presentation and reason for coming in for therapy. So whether that be a specific diagnosis or current concern, or recent like crisis or trauma, and also a risk assessment that assesses how they're doing in that moment.
Okay. And as far as the therapy component of your interactions, is that largely based on the patient?
Yes.
And what kinds of therapy can you offer in that short-term therapy?
In that short-term therapy, we offer cognitive behavioral therapy, dialectical behavioral therapy. I also offer something called EMDR, eye movement desensitization and reprocessing therapy for patients that have gone through trauma, as well as it could be even short-term support, like a couple of weeks until they're transferred to the appropriate level of care.
And in your sessions with patients, is there a minimum or a maximum time limit?
Typically, our program would go from birth to postpartum up to 2 years. If it did go a little bit over 2 years because of lack of connection to care, then it would go a little beyond that, but typically it's 2 years.
Okay, and that's the duration of your treatment or your interaction with patients. But what about in each appointment that you have? Is there a minimum or maximum time set by the clinic of when you see a patient in a particular visit?
Yes. So do you mean as far as like weekly or like hour, half an hour?
Well, I guess the question is, if a patient's coming into you because they were referred and you're meeting with them on a regular basis, how long are the appointments in duration?
Duke's
An hour,
testimony
half
gets
an
into her
hour?
actual sessions with Lindsay and what Lindsay was reporting to her.